For many LGBT persons, displacement does not end the danger, but changes the nature of the threats they face. As legal pathways narrow, many are forced into perilous journeys, exposing them to exploitation, sexual violence, and abuse. Not only from criminal networks and authorities, but also from fellow asylum seekers. Transgender individuals face specific challenges, including barriers to accurate identity documents, unsafe housing placements, and structural discrimination throughout the displacement process. Displaced LGBT persons are frequently excluded from humanitarian services and denied access to safe shelter, healthcare, and other essential support. States should expand safe legal pathways to protection and ensure that humanitarian actors are trained to meet the specific needs of LGBT individuals. Refugee status determination is central in international protection, yet LGBT persons often face significant barriers in accessing it. Barriers include fear of disclosing their identity, biased or inappropriate interview questions, lack of legal assistance, and status determination decisions based on stereotypes rather than their actual lived experiences. Many are denied protection simply because they are unable to safely or promptly articulate the grounds of their persecution. Some states have taken steps to address these challenges. In Poland, civil society groups have trained asylum officials and reception staff on sexual orientation and gender identity, including credibility assessment and barriers faced by LGBT asylum seekers. States should follow such examples by ensuring that LGBT persons can claim protection based on sexual orientation and gender identity by adopting gender-sensitive procedures, utilizing inclusive documentation practices, and training officials to assess claims fairly and without bias. Upon arrival, LGBT refugees and asylum seekers often encounter systemic barriers to accessing housing, healthcare, employment, and community support. Discrimination by service providers, unsafe or inappropriate accommodations, lack of access to gender-affirming care, and exclusion from mental health and social services continue to undermine their safety, dignity, and well-being.